My name is Rios. I'm the Vice President of Client Services in the healthcare practice. Previously, before joining Xtium, I was the CIO of a federal qualified health center in the city of Philadelphia. I also currently a professor at the University of Phoenix, where I teach healthcare informatics. Before I was an employee of Xtium, I was asked to speak on panel discussions in regards to cloud, and more importantly about Xtium. I felt that they were really there in regards to the need of not only the numerous businesses that are out there, but in regards to healthcare and the patient information and being able to protect it. They were a company that wanted to make a difference in the community, and to me that was very important because my philosophy in life is everything I do, I just want to make a difference. Back in the day, the patient goes in the room, there's a paper chart, the provider takes care of the patient, dictates, moves on to the next patient. Now that FQHCs now need to be electronic, technically they are, by the end of 2014 everyone had to be electronic, everything needs to be in a way that I need to get to my data no matter what, anytime, anywhere, be up all the time. So back in the day where, again, with the paper charts, it wasn't necessarily important that the system had to be up all the time. It's a little different now. So in a DR standpoint, if something were to happen in regards to the local facility, I can still get to my data from a disaster recovery, whereas Xtium provides that not only on the East Coast, but as well as a DR scenario over in the West Coast as well. So there's 4 key components to that: cost, accessibility, security, and just as importantly, uptime. So with cost, we're in stages, if companies have local servers, and we're talking about FQHCs, so FQHCs have local servers in their data center. Every 3 to 5 years, they have to go through a process of refreshing this hardware. That cost goes away when you're in a managed service provider. The fact that you have expandability, capacity as well, you can do anything at any time in that process. When you have the equipment local at the facility, you don't have that availability. Accessibility, anytime, anywhere. We're in a world now with the electronic health record in the FQHC market. I need to get to my patient chart. I can be at Starbucks, I can be at any company out there, or I can be in any library and be able to get to that patient chart. Because a managed service provider has the availability of having multiple internet service providers, so no matter what, anywhere, anytime, I can still get in and get to my patient record. So with security, probably one of the most key components of the 4 is that with HIPAA and meaningful use high tech, to be able to, my data needs to be not only protected from a security standpoint, but encrypted at a storage level. So when I say data at rest, that means where my data sits, my patient health information, PHI, is sitting, needs to be encrypted. So that could be at a desktop, it could be at a laptop, but more importantly for a managed service provider, at the storage level. That data needs to be encrypted no matter what. So as meaningful use goes along in the healthcare world, there are going to be those requirements that data needs to be encrypted and it needs to be proven. If that data is not encrypted, you're not receiving those incentive dollars and you are failing your security assessments as well. Just as important as security is the uptime. Uptime is meaning being able to be up 100% of the time. Let me get to my data 100% of the time. The days of having a paper chart with the provider is a thing of the past. We are now in an age where we're electronic. I need to get to my data. I need to treat the patient. They're in front of me. I need to have it up. If my data were to go down at any time, I can't properly treat the patient. So uptime is key. So at any point, any time, whether it's in a disaster scenario or in a true hosting scenario, either way, my data needs to be up as close to 100% as possible. Like FQHCs or any health center or hospital today, HIPAA is always going to be there. There's always going to be need for data and protection of your patient data. Now with meaningful use, and meaningful use has currently 5 stages to go through for providers to receive incentive money, we are currently in stage 2. As time goes on, those requirements are going to continually change. Xtium is flexible enough to make those changes and grow with you as an organization. So as we partner together and collaborate, we want to make sure you're successful as an FQHC to always achieve the stage that you're in, as well as receive those incentive dollars.